Our lecture today is about the digestive system. We can imagine the digestive system as a long tract or tube with two openings, the mouth and the anus. We also have three accessory organs, which is the salivary gland, liver, and pancreas. We will start with the first part of gastrointestinal tract, which is the mouth, and the mouth is designed in a way to enable it to perform its function, which is the breakdown of the food particle. And for this purposes, the mouth has the anterior incisor teeth, which provide a strong cutting action, and the posterior molar tooth, which give a grinding action. Also, we have the muscle of the mastication, which act together to open and close the mouth, and these muscles are innervated by the motor branch of trigeminal nerve. Also, the chewing reflex is controlled by a nuclei located in the brainstem. Now we are going to discuss the mechanism of mastication. When we put the bolus of the food inside the mouth, there is a voluntary contraction of the muscle of the jaw, and this contraction will bring the bolus of the food in contact with the lining of the mouth. This results in stimulation of the buccal receptor, and this stimulation will cause reflex inhibition of the muscle of mastication, which causes the lower jaw to drop, and this drop in turn initiate a stretch reflex of the jaw of the muscle that lead to rebound contraction, and this automatically will raise the jaw to cause closure of the teeth, and again the bolus of the food become in contact with the lining of the mouth, and this circle will be repeated again and again until the bolus of the food pass into the pharynx. The importance of chewing is to break down the food element and to increase the surface area. This will facilitate the digestion, and in addition it will mix the food with the salivary gland to facilitate the swallowing. Chewing also brings the food into contact with the taste receptor, and this sensation generated by this receptor increase the pleasure of eating and initiate the gastric secretion. Now we are going to discuss the saliva and salivary gland. The normal secretion of saliva is between 800 to 1500 ml per day, and the principal gland of salivation is submandibular gland, which is responsible for the production of about 70% of the total saliva. The parotid gland, which is responsible for the secretion of about 25% of saliva, and submandibular gland, which is responsible to secretion of only 5% of saliva. And we also have many small buccal glands. The salivary secretion have two major types of secretion, which is the serous secretion, which is a watery secretion, contain the enzyme thiolin. The other name is alpha amylase, which is an enzyme for the digestion of starch and polysaccharide. And the mucus secretion, which contain mucin, which is important for the lubrication and protection function. It is important to know that the parotid gland secrete only serous secretion, while the submandibular and sublingual gland have mixed secretion. It secretes both serous and mucus secretion, and the buccal gland secrete only mucus secretion. In comparison to plasma, the saliva is hypotonic, contain higher concentration of potassium ion and bicarbonate ion, with the lower concentration of sodium and chloride ion. Saliva has a pH between 6 and 7.4. To understand this composition, we should understand the mechanism of production of saliva. A typical gland contains acini and duct, and the salivary secretion is passed into stage. The first stage involves the acini, and the acini secrete an initial saliva, which is a plasma-like solution, isotonic solution, and they will contain extracellular fluid, thioline, and or mucus protein. As the second stage involves the salivary duct, and as the primary secretion follow through the duct, two major active transport will occur. The first involve sodium reabsorption in exchange with the potassium, and for each sodium, 3 molecule of sodium reabsorbed, there is 2 molecule of potassium secreted into the lumen, and this will create a negativity inside the lumen because the potassium enter is less than the sodium key get out, and to control this negativity, the chloride ion will reabsorb passively without energy. And the second active transport is the bicarbonate ion will be secreted inside the lumen actively or partly in exchange with the chloride ion. The end result of composition of saliva, there is low concentration of sodium and chloride and high concentration of potassium and bicarbonate. After understanding the mechanism of salivary secretion, we should ask a question. Is the flow rate of saliva can affect the composition of saliva? And the answer is yes. At higher flow rate, if the flow of salivary secretion is very high, there is no time for the active transport to occur, so the composition of saliva is like the initial saliva, which is plasma-like isotonic secretion. But at a low flow rate, these active transports will occur, and the final saliva will have a low sodium and bicarbonate ion concentration and very high potassium and bicarbonate ion concentration. Nervous control of the salivary gland. Salivary glands are controlled by the salivary nuclei, which is located at the junction of the medulla and the bones, and these salivary nuclei control the salivary gland majorly by the parasympathetic fiber, which pass through the facial nerve, 7th cranial nerve, and through the ninth cranial nerve, which is the glossopharyngeal nerve, and also to a less extent by the sympathetic fiber, which is originate from the superior cervical ganglia and travel along the blood vessel to the salivary gland. The salivary production is unique because the fact that both parasympathetic and sympathetic activity will increase the salivary production, but there is difference in the type of the secretion. For example, for the parasympathetic stimulation, there is increase in the watery saliva, which is rich in the enzyme alpha amylase. While the stimulation of sympathetic nerve will cause production of a small volume of thick saliva, which is rich in mucus. Salivary nuclei are excited or inhibited by a signal originated from three different parts. First, this signal originated from the mouth. For example, there is two stimuli, taste stimuli and the tactile stimuli. For the taste stimuli, for example, sour taste will have an excitatory effect, while the bitter taste has an inhibitory effect. And the smooth object in the mouth also has an excitatory effect. Second type of signal originated from higher center. For example, thinking about the food, smell the food, or see the food will increase the signal that stimulate the salivary production. Finally, signal originated from the stomach. If there is an irritating substance in the stomach, this will stimulate the salivary production, and this swallowed saliva will help to remove the irritating factor in the GIT by diluting or neutralizing the irritant substance. Function of the saliva. Saliva has three important functions, which is the protection of the mouth in order to maintain a healthy oral tissue, and the mouth, because the mouth has pathogenic bacteria that can easily destroy the tissue and cause dental caries. However, saliva prevents this harmful effect of bacteria by two ways. First, continuous washing away the pathogenic bacteria, as well as the food particles that provide the bacteria with metabolic support. And the second way is saliva has many factors that can kill the bacteria, such as thiocyanate ion, which is bactericidal ion, and proteolytic enzyme and antibodies like antibody type A. The second function of the saliva is the digestion of starch by the enzyme alpha amylase, and to less extent the digestion of the fat by the lingual lipase. And the third function is the lubrication of the food, making the swallowing easier and moisten the mouth and facilitating the speech. Also, saliva neutralizes any gastric acid that reflects from the stomach into the lower esophagus.